Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, and my co-host for today is Dr. Andreas Mitchell, Roots Primary Care Physician and Diabetes Program Director, and we are reporting for the week of May 15th, 2023. Following a status update on COVID, we will review COVID and diabetes. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. As I discussed in some detail last week, with the public health emergency declaration ending on May 11th, a lot of shifts have been happening in terms of the surveillance that we've been monitoring all this time. Some data sources have been discontinued. It seems that the CDC no longer has the authority to require many of them, and others were downgraded in terms of how frequently they're going to be updated. I mentioned last week that I thought that the most important and reliable data we would be able to look at would include death, hospitalizations, sequencing, and wastewater. And now I will add one more, which is emergency department visits. And that's because we seem to have a new map that's going to be giving us that information. So the morbidity and mortality weekly report that I touched on last week is indicating that although COVID-19 cases and associated hospitalizations have decreased in the recent months, COVID-19 remains an ongoing public health challenge. And what they are saying is that their updated public health tracking is going to change from what we've had before. We won't have the community levels and the community transmission maps. And what we will have now is hospital admissions, which will give us a good idea about spread in communities, although this gives us a little bit of a late idea. It's a little bit on the late side, but more importantly, probably, is that we will get an idea about the severity of illness with COVID when we see hospitalizations going up. Death certificates will also give us a sense of the severity of illness. We know that this is a very late indicator, meaning that by the time we see an increase in deaths, it's usually several weeks or even over a month following a rise in cases. But it could be helpful, for example, for seeing earlier signs of spread and illness, let's say in one part of the country, that we may be predicting how it's spreading into other parts of the country, but that really remains to be seen. Next is the emergency department visits, which may give a little earlier sign of spread, although we know that many people with SARS-CoV-2 will not present to the emergency department. But still, this is a new map that we'll certainly be keeping an eye on as things progress. And lastly, genomic sequencing, and this is to track for new variants. They don't mention wastewater here, although wastewater is something that the CDC is collecting information on. And sequencing can happen from actual specimens that are collected, and it can also happen from the wastewater as well. So these will be important to keep an eye on, because this will hopefully give us some advance warning for dealing with problematic variants. So as of May 11th, the CDC COVID data tracker page has been renamed Trends in US COVID Hospitalizations, Deaths, and Emergency Visits by Geographic Area. And the old case data and death data are going to be archived with a final update on June 1st, 2023. So taking a look at the revamped page, you can see that they are highlighting hospitalizations, deaths, and vaccination here, and you can actually click on any of these areas to get more information, and you can choose to look at graphs or maps. And just to give you an idea of what the new maps look like, we can see here that you can choose emergency visits, deaths, hospitalizations, and you can choose different metrics to look at. For example, if we want to see ICU beds occupied by COVID-19 patients, we can click there. If we want to see total number of ICU beds, you can see that several counties are actually lighting up. So this may be of interest to you in your area. You can also look at the change in percent from prior weeks. So this is something that we will continue to track and report back on as things progress. And I'm not going to spend too much time on these maps or graphs right now because we know that we're in our usual springtime lull and things are stabilizing even regarding the data inputs for all of this. So there's nothing too remarkable to see here. And this is something that we will continue to monitor, but certainly if you want to drill down to see what's going on in your specific area or your specific county, this could come in handy, especially if the reporting is going to be timely. Total current confirmed deaths from COVID are 1,131,030 people who've lost their lives due to COVID. And out of those, 36,242 are just this year in 2023. And the lowest weekly number of deaths so far in the pandemic is the week ending April 15th. And that is the last week that we have confirmed data for. So this is actually an improvement because this marks the third week in a row where confirmed deaths were the lowest of the pandemic. So it's still hard to call over 1,000 deaths in 1 week any kind of good news, but at least we're going in the right direction and hopefully we'll continue to, but we will stay prepared. And looking at current wastewater levels, we can see a lot of the cool colors, which means that cases overall are on the lower side, and that's a good thing. And there has been an addition of 148 new sites. So now there's over 1,500 wastewater sampling sites that are reporting to the CDC. We hope to continue seeing that number go up, as we can see that there are some states with very little, and then there's some states with quite a lot. And if you're in a state with a lot of wastewater sites that are reporting, this can be very useful information for you to drill down into if you're someone who's keeping an eye on what is going on with COVID in your area. This map is showing the percentage of change of SARS-CoV-2 concentrations in the last 15 days in the wastewater. And I'm showing this because it is revealing some areas in the country where there is a dramatic increase. You can see all of the red dots throughout the country, and that signifies 1,000% or more increase over the last 15 days. So this may be followed by some increase in the burden of SARS-CoV-2 in multiple states there. And again, this may be worth looking at. I've put a link to the wastewater scan testing dashboard. The link is in the post. You can look at the map of the US and drill down into your area. When I take a look at Oakland, California, you can see that there are 6 viruses being monitored in the wastewater. And currently, we do see a little uptick in SARS-CoV-2 happening right now. There's also a little bit of human metapneumovirus circulating. I reviewed this in detail a few weeks ago, presents as a respiratory illness. And when we look at the others, Mpox is still flat. We'll keep an eye on that. Flu season seems to be over. RSV seems to be over for now as well. And norovirus is coming down and flattening out, and that's the one that causes the diarrhea and vomiting. And so we've still got some SARS-CoV-2 circulating around, but this may be of interest to see what all they are tracking in your area. Turning now to variant proportions, we can see that the forecasts here show that XBB.1.5 continues to decrease. It was close to 90% at one point. Now it's down to 64%. While XBB.1.16 keeps climbing. These are all Omicron subvariants at this point. They are all very highly contagious. So far, there's no indication that this is making people any more or any less sick than the variants before them. And we do, as usual, have some variability across the country, but right now, nothing really distinguishing these different variants in terms of how sick they make people or how much they send people to the hospital that we know of, so nothing of significance to note here at the moment. And we know that along with the ending of the public health emergency declaration, that there are a lot of shifts in what's going to be available, what's going to be paid for or not. I reviewed this in some detail last week. If you want to check that out, I was talking about vaccination, testing, telehealth, and some other things. But today I just wanted to point out that you can still get 4 free tests from the federal government. That will continue through the end of this month, so through the end of May. So you have a couple more weeks to go to covid.gov/tests. Very simple and quick process. I wish that they would also send free masks this way, free filtration masks, but at least get your 4 free tests. And as a reminder, these tests come in handy if you get any COVID symptoms, and that includes things that you may just be brushing off as allergies. A sore throat is still one of the most common initial symptoms that we're seeing. So if you get a sore throat, just take a COVID test just to be on the safe side. Also, if you're exposed to someone who had COVID, you should be testing yourself every couple of days while you mask around others. And also, prior to an event or indoor gathering, you might consider pre-event testing. This just might avoid your event turning into a super spreader. And now we're going to review some things about COVID and diabetes. First off, diabetes is a common chronic illness. There are an estimated 422 million people worldwide who have diabetes, and 1.5 million deaths annually are directly due to diabetes. And overall, the number of people getting diabetes, so new cases of diabetes, as well as the total number of people with diabetes, so kind of our overall burden of diabetes, those have both been steadily increasing over the past few decades. So this is not something where we've been doing a good job controlling. Quite on the contrary, it has been steadily increasing. Sometimes the symptoms of diabetes can come on suddenly, but especially with the type 2 diabetes, which is the one that presents a little bit later, usually in adulthood, but we're starting to see it younger and younger. This can start off a little more slowly. It can start off mild. It can take months, even years before being diagnosed with diabetes. And so this is something where we really want to intervene because we want to know the sooner the better. Even when someone has pre-diabetes, we want to know so that we can intervene. And it could be with diet and weight loss and things like that. And we also have a number of medications, oral medications, and of course, insulin and many others. And the usual symptoms when diabetes first starts are feeling very thirsty, urinating more than usual, could have blurry vision, if you're unintentionally losing weight or feeling very fatigued. And so those are some of the early signs of diabetes. Now, from the earliest days of the pandemic, we knew that people with diabetes were at a higher risk of doing poorly if they caught COVID. So that's something that we were seeing from the very beginning. And that wasn't really a surprise because we know that diabetes does make people more susceptible to a number of different infections like flu and pneumonia. And not too long after that, we learned that getting COVID could worsen a person's diabetes. So it could become harder to manage diabetes after a COVID infection. And then later in the pandemic, we learned that COVID can actually cause the new onset of diabetes. So this was very unwelcome news because, as I mentioned, we already have a very high burden of diabetes. And so to have this pandemic that's affecting so many people actually causing diabetes is just really adding kind of a wave after a wave. And it's a wave of chronic illness that we're already struggling to keep up with. And there are a number of different factors that are probably at play with this, but we don't have a complete understanding yet of why COVID is actually causing quite a bit of new onset diabetes. So diabetes and COVID are kind of this two-way street where diabetes can make COVID worse, and COVID can make diabetes worse, or it could even cause diabetes. And this is something important for us to pay attention to, given how much diabetes we already have in our community. And in fact, the way that diabetes and COVID are kind of working together and compounding each other is what we sometimes called a syndemic status. And that refers to two different epidemics, or a pandemic and an epidemic, that occur simultaneously and kind of amplify or aggravate each other. And so that is the situation with COVID and diabetes. And now I'm going to pass it over to Dr. Andreas Mitchell to give us more details about diabetes and COVID.
Hello, everyone. I'm Dr. Andreas Mitchell, and I'm a primary care physician at Roots and the director of our diabetes program. I'm here to give an update on diabetes, particularly as it relates to COVID, and the importance of screening and diabetes control. I've been thinking about this a lot recently as I just met a new patient who is on minimal diabetes medication until he was infected with COVID, and since then has been requiring 90 units of insulin per day and still has trouble with his sugars. Unfortunately, this experience is not at all unique, as COVID infection has been shown to increase the risk of new and worsening diabetes. Just this month, in the leading diabetes journal, a new article was published on this topic. Before diving into it, it's important to review a number called the hemoglobin A1C, which is a measure of your average blood sugar over the last 3 months. An A1C less than 5.7 is considered normal. Between 5.8 and 6.4 is considered prediabetes, and 6.5 and above is in the range of diabetes. If you don't know your A1C, be sure to ask your provider about getting tested. So the study I mentioned looked at 8,755 patients with a positive COVID test and matched them to about 12,000 patients who had a negative COVID test. They were all at the Cleveland Clinic, and they all had at least one prior A1C measurement within the year before their COVID test. And so first, the researchers confirmed what many other studies have shown, which is that higher blood sugars, meaning higher A1C, is associated with more COVID-19 complications. Each graph here shows A1Cs increasing from left to right, and the frequency of complications increasing as you go up. So you can see here that as A1Cs go up, hospitalizations, the need for assisted breathing, ventilation, and ICU admission all go up as well. So for those with diabetes, blood sugar and A1C control are extremely important for reducing the risk of severe illness from COVID. We've seen this in the CDC data as well, which have most recently shown that 14.8% of patients who died of COVID had diabetes, compared to in the general population, which is only an 11% rate of diabetes. Next, they looked at the risk of developing diabetes after COVID-19 infection. This was an important new finding. They showed that patients who had COVID-19 had 1.4 times the odds of developing type 2 diabetes after their infection compared to patients who didn't have COVID. This shows that COVID is an important risk factor for developing diabetes. I do want to highlight one last finding from the study. They looked at rates of diabetic ketoacidosis, or DKA, after COVID infection. DKA is a life-threatening medical emergency caused by very high blood sugars. The researchers found that Black patients with type 2 diabetes had more than twice the rate of DKA after COVID infection compared to white patients. There's clearly more research needed here to understand the causes, but it's important for Black patients with diabetes to know that their risk of diabetes complications may be higher than average after COVID. I do want to end with one hopeful study from back in February, which looked at the rates of developing diabetes, high blood pressure, or high cholesterol after COVID infection. It also showed higher rates of diabetes after COVID, but that the effect was much more severe in those who were unvaccinated, as you can see on the left, compared to those who were vaccinated in the graph on the right. So the take-home points are that the A1C is a measure of your average blood sugar. Most adults should get their A1C checked periodically to screen for diabetes. If you don't know your A1C, ask your primary care provider if you should have it checked. Among those with diabetes, better A1C control means lower risk of COVID-19 complications and death. Black patients with type 2 diabetes are more than twice as likely to develop DKA, which is a medical emergency caused by high blood sugar, after COVID-19 infection as compared to white patients. COVID-19 does increase the risk of developing diabetes, but the risk is much less in those who are vaccinated. And finally, just to note that for those who are Roots patients, we have A1C testing available, as well as we offer diabetes group visits for those with diabetes and pre-diabetes to keep their A1C in good control. Thanks so much for the opportunity to share these updates with you, and I'll turn it over back to Dr. Noha.
Thanks to Dr. Mitchell for that excellent information on diabetes and COVID. So once again, diabetes and COVID are kind of a two-way street. We're really still learning about all the ins and outs with that. We know that there's a link between SARS-CoV-2 and blood sugar levels. We know there's a link between SARS-CoV-2 and inflammation. We know that SARS-CoV-2 attaches to our ACE receptors, which are all throughout the body, and that it can affect the kidneys and the whole system of hormones and enzymes and proteins in the body that regulate blood pressure and heart disease and inflammation. So there are a lot of theories about exactly how these things are interacting with one another, but still not a way to really predict when this is going to happen or prevent it from happening per se. So our best advice at this point is, first off, if you don't know if you have diabetes, please find out. Check in with your doctor, see if you can get checked for your hemoglobin A1C levels. If you have diabetes already, then we'll want to work to keep it controlled, keep those blood sugar levels controlled, and keep that A1C in the desirable range. And then your risk of a bad outcome from COVID and from the diabetes goes down. So really keeping good control of your diabetes is important no matter what, but it actually will reduce your risk of doing very poorly if you do happen to get COVID. And we want you to do what you can to avoid catching COVID in the first place, of course. If you've had COVID and you've recovered, then make sure you're checking in regularly with your doctor, just like you should be anyway. But you'll want to be checked on your kidney function and on your diabetes control after infection, because we know sometimes that diabetes can get more difficult to control, just like Dr. Mitchell shared after a COVID infection. And I really hope that all of our loved ones with diabetes are fully vaccinated. But if you or someone you care about, someone you know has diabetes, has not been vaccinated, please send them a link to this video. Maybe they can reconsider. And if for whatever reason they did not want to get the mRNA vaccine, that's okay. Let's make sure they know that Novavax is an option for them. Remember, Novavax uses an older type of technology that we use in other vaccines. So some people may feel more comfortable with the Novavax, and it is an option remaining for our remaining unvaccinated people. If you have diabetes and you do catch COVID, you want to know as soon as possible, because diabetes is definitely one of the underlying conditions that makes you eligible for treatment. So we want you to get tested and get treated in a timely fashion. And as a reminder, here are our outpatient treatments for SARS-CoV-2. Number one choice for most people is going to be Paxlovid. That's the oral treatment that's available for ages 12 and up. Now, we do have little ones with diabetes, type 1 and even type 2 diabetes. And for them, if they're under 12, remdesivir may be the treatment choice. This is IV treatment that's given 3 days in a row. So it will be important to have this conversation with your doctor in advance or with your child's pediatrician in advance, so that you will have a treatment plan lined up and you will know where it is that you're going to access this treatment. And lastly is molnupiravir, which is not as effective as the first or second choice, but it is a viable third choice. Now, thankfully, we are in a comparative lull with SARS-CoV-2 right now, as we've been every year at this time, and that is a good thing. But just as before, this does not mean let our guard down. There's still quite a bit of SARS-CoV-2 circulating. And with the dropping of many precautions, we are still seeing quite a bit of cases and outbreaks. And even in a lull, too many are being hospitalized, too many are still dying, over 1,000 people weekly in the US alone. And of course, we would be wise to prepare for increases over the coming months. We've had summer surges literally every summer in the pandemic so far, so it will be good to stay prepared for that. We are still learning about the effects of COVID infections, of COVID repeat infections. We're still learning about post-COVID events and about long COVID. And what we do know is that if you caught COVID once and you did fine, that's not a guarantee about how you're going to do the next time. So we want everyone to do what they can to avoid a potential bad outcome or a potential post-COVID or long-term effects for themselves and also for their contacts. So please do what you can to avoid getting infected or reinfected or spreading it to others. Gathering outdoors is always safer than gathering indoors. If you will be gathering indoors, make efforts to improve indoor air quality, like adding HEPA filtration units, keeping the central air running with a MERV 13 or higher filter, opening doors or windows. If you must spend time indoors with others, especially members of the public, especially if there's no pre-event testing, wear a high quality filtration mask like an N95, a KN95, or a KF94. Consider using rapid tests for pre-event testing. Whoever is positive needs to be excused from the event. If you've been exposed or if you have symptoms, conduct a rapid test every day or two while continuing to wear a filtration mask around others, or get a more definitive PCR test. If you are someone who needs to be treated, or if you spend time with someone unmasked who would be treated for COVID. go ahead and definitely get that more definitive PCR test so that we can facilitate timely treatment. Remember, you only have 5 days in most cases to start the treatment, and the sooner the better. We could reduce COVID hospitalizations and deaths substantially if everyone who is eligible got treated. And if you test positive, please reach out to anyone that you are around, especially unmasked, for the 3 to 4 days before you started symptoms or tested positive. You want them to be able to get themselves tested and to isolate from vulnerable people. And the more we can cut off these chains of transmission, it's always better. If you are positive, please do an antigen test to exit isolation. In general, we believe that if you have enough virus to detect, that is enough virus to infect. And also, please don't push yourself. Try to allow yourself the time you need to fully recover. Please do not show up to school or work feeling sick and exposing others. This creates more chains of transmission, and we don't know who you could harm or even kill. Stay home and rest, but if you absolutely must go out, a well-fitted N95 mask could keep you from harming another person. And as always, remember to eat a balanced diet, incorporate fruits and vegetables, avoid sugary drinks. Consider a multivitamin supplement, get your blood pressure checked, your baseline labs, get that sugar checked, your A1C checked, ask your doctor about it, cholesterol, vitamin D levels checked, get some regular physical activity, unless you're sick, and then we want you to rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.